get started. Um, and then as people trickle in, uh, that'll be fine. So, welcome today to Dr. Colleen Moran, Director of Pediatric Inpatient Services. Today, Dr. Moran is going to be sharing spring family safety tips with us. So, take it away.
All right. Thanks, Courtney. Is anybody else hearing an echo, or is that just me?
I'm hearing one too. If everyone could just mute their mics, that would be great.
Perfect. All right. So I feel a little bit funny that we're talking about spring weather and being outside when we're having another good snowstorm happening, but spring will come, and we'll all spend more time outside without all of our snow gear on. So making sure that people see when I advance the slides. Is that all set?
Yeah, it looks good.
Perfect. Okay. So again, we don't have a ton of time, and as we all know, there's lots of different things that we think about with keeping kids and our family safe. So we're going to hit some of the highlights that we kind of focus on when we're thinking about spring ahead, and some of the things that maybe we haven't used as much during the winter season and to remember to use as we start to head into the spring season. So again, we don't have time to cover it all, but we'll hit some of the highlights and then provide some resources for further details. So when we think about inside, we could probably spend hours talking about how to safely child-proof a house, but just quickly thinking about those gates and latches and locks, outlet covers. And then it's a good time to, if depending on how old your children are, that they might have gone from being immobile to mobile. So checking to make sure that furniture is secured and those kinds of things. And then we'll talk a little bit about the risks of ingestions within the home. So as you start to do those spring cleaning and spring organizing, remembering to make sure to re-secure all of your cleaning supplies, and also not to transfer cleaning supplies from a labeled bottle to an unlabeled bottle. And the other thing is, as we start to open windows and doors and put in screens, making sure that they're safely secured and locked. Most window guards are actually not safe for kids, so doing things like opening the top of the window instead of the bottom of the window, and then confirming that any windows that kids can kind of bang on, that they are that shatterproof glass. And also looking at the window dressing. So again, as kids have gotten a little bit older and maybe more curious over the winter months, making sure that the blinds or other strings for window dressings are secure. We'll talk a little bit about who to have and what to have listed for emergency contacts, the importance of locking up medications and other things that we need to make sure we keep out of curious toddlers' hands, firearm safety, and then smoke detectors and carbon monoxide detectors. So again, we sometimes think about this as the babysitter list or the caretaker list, that having things like 911, poison control posted in an easy and accessible place, having that home address. So if somebody who doesn't live in that home, when they do call 911, they can identify where they are, the contact information for the guardians, and any other emergency contacts. So sometimes a grandparent or aunt or a neighbor, the primary care provider. And then it's also important, and then this usually needs to be updated, is the kids' names and birthdays that live in the home. So how old are they? Any medical conditions, allergies, any regular medications. And sometimes it's nice to actually just put the dosing down for things like Tylenol, ibuprofen, or other common medications that child might need to take, and then a recent weight. So that way, if they do need to dose any medications or call poison control, they have that information right there. So there's lots of different templates online. Care.com actually has a fair number that you can actually fill out and then print. And then it's just important to take a look at your most recent one, and that it has the most up-to-date information, because kids grow, so their weights are going to change, and sometimes phone numbers or who you want that kind of second or third call to go to might need to be updated. So again, the place where the most accidents happen is at home. So if we think about all those spring cleaning and tidying and organizing that we do, but we also want to make sure that everybody's safe. So one trick is to have like an empty Rubbermaid container or container that you can secure the lid, that if you're in the midst of a project, you can put everything into that and then secure it. So that way all the cleaning supplies or other tools that you might not want to leave out for the child to get into. This goes over some of the same lists of essentially making sure that the window dressings are safe. You want to make sure that your household cleaning products and medications are out of sight, out of reach, and that they're locked safely. And again, making sure that larger furniture items or televisions, things like that, are secure. You want to test and then replace the batteries of any smoke alarms and carbon monoxide detectors. And again, making sure to clean up after yourself. So if you do something in the garage or, other sort of deeper cleaning activities, making sure that you put all those things away so the child can't get into them. And we always talk about making sure that guns are safely secured and locked. There's lots of studies that do show that even children that are told to not touch things, they tend to be quite curious about firearms. They're safer, obviously, when they're in a lockbox and unloaded and that the ammunition is stored separately. The safest place for guns when you have young children in the home and even adolescents or older age folks that might be at higher risk for suicidal ideation is to have the guns outside of the home. And it's always important to ask when a child is going to somebody else's home whether there's firearms in the home and how they're secured. So again, we want to keep our firearms locked, and there's lots of different options for those. So there's lock boxes, there's safes, there's also the trigger locks, and then having a separate space for the ammunition. And then for our carbon monoxide and smoke detectors, so we always want to have a smoke and a fire alarm on every level and in every bedroom. The carbon monoxide detectors, it varies with recommendations, but essentially needs to be within on every level and near each bedroom. So some recommendations are as long as it's in an upstairs hallway in between the bedrooms. And then a fire extinguisher on every level, and then also in those higher risk areas of having them in the kitchen and the garage. There are options for low cost or no cost. So through FireSafe 802, which is a community risk reduction program. So sometimes calling your local fire department or other local resources, they can help with the cost of that. Any home that's rented, there's lots of tenant protection laws around making sure that there's appropriate smoke and carbon monoxide detectors so that those shouldn't be cost prohibitive for families. So we do know that ingestions are one of the most common causes for presentation to the emergency department or the primary care provider. The risk of an accidental ingestion is much higher in kids under the age of 6. And the two most common things would be cosmetics or personal care products, and then cleaning substances. And then the other ingestion that's often accidental is accidentally an ingestion of a medication. So sometimes when a child has a fever and the parents are alternating between, for example, acetaminophen and ibuprofen, they might accidentally give one versus the other. So it's important to write that down, especially if there's more than one caregiver giving the medication. But again, this further emphasizes the importance of securing those things like cosmetics and cleaning substances. The other thing that we're seeing a big increase in is accidental ingestion of marijuana or THC, especially with the edibles. So when you look at the packaging, that many of these look exactly like candy, or they've actually been removed from the packaging that clearly identifies them as having THC and put into a different container. The important thing to know is that THC ingestion through an edible often has a pretty delayed effect. So it's important for those children to have poison control notified and present to the local emergency department. Similar to firearm safety, it's okay to ask before a child goes to a family or friend's home if they do have edibles and where are they stored. The other thing that we think about also are e-cigarettes or other things that can sometimes look like candy or look like toys that curious kids will often get into. So it doesn't matter where you are, you can give poison control a call. You can also click on their online help forum. This is one of the reasons why having the child's weight and age can be helpful because it helps determine essentially the next steps. We use poison control. We call them while patients are in the emergency department. They offer phenomenal advice. We can talk with pharmacists and toxicologists. And so you can get that process started even prior to presenting to the emergency department. So moving to the outdoor, when we think about, lots of the things that we all think about on a regular basis, but we don't worry about quite as much during the winter seasons in Vermont is sun protection. So for infants younger than 6 months, overall, we try and minimize their exposure. So there's lots of great sun protective clothing, hats, sunglasses, keeping them in the shade, so under a tree or under an umbrella, and that you can use sunscreen, and ideally it would be an SPF of 30 and above. Again, for the younger kids, especially under the age of 2 months, you want to minimize the amount of sunscreen, but you'd rather have some sunscreen if they are going to have sun exposure. So sometimes on the face or the back of the hands, those areas that we can't completely cover. For bug protection, we don't use bug spray on kids under the age of 2 months, but you can use it on things that are around them. So sometimes around the stroller or putting bug netting over the stroller or even over the carrier that the child is in. The most effective ingredient that we currently have for keeping mosquitoes and other parasites like ticks is DEET, and usually using between 10 to 30% has a minimal negative effect, but also helps with protection. You can also get permethrin clothing and things like that. Again, if you want to minimize skin exposure, and then you can also just put the bug spray or the DEET on things like the shoes, the socks, or the other items, and then making sure you wash those before they get put in with all of the other clothes. Again, the weather can be pretty unpredictable, right? We can go from 40 to 50 to sunny and we feel like it's lovely, and then the sun goes down or it starts to sleet sideways or snow. So we often joke in Vermont, right? If you don't like the weather, just wait 15 minutes. So similarly with being prepared for those weather swings and having a change of clothes or just, the clothing for the different temperatures that you might see. We'll talk a little bit about ticks and also just remembering for hydration. So again, every time the child comes inside, or at least once a day, so usually before bedtime, it's important to do a tick check. Ticks die from heat, they don't die from water. So even if a child has been bathed or showered, they can still end up with ticks still on their bodies. So you think about those warm, dark places where they like to hide. So the hairline, behind the neck, under the arms, the belly button, in the groin area, the backs of the knees, and then sometimes between the toes and those kinds of things. So for older kids, you can teach them about how to check for ticks. The younger kids, you can often do this as you change into PJs or you get ready for the bath or out of the bath. But again, remember that a showered or bathed child could still have ticks attached. When you're removing a tick, you want to make sure that you actually get the whole thing out. So that's where this picture shows using the tweezers up by the head of the tick. If you're ever unsure, you can call your primary care, urgent care, or other resources. You don't want to do things like try and burn the tick or put petroleum jelly or other things like that. And then sometimes people like to put the tick into a little Ziploc bag or a container, and that way you can help if you're not sure how to identify that tick. So these are some of the common, the ones that we think about as transmitting most tick-borne illnesses in Vermont are the black-legged ticks. So again, it's the nymphs or the larvae, the really teeny tiny ones that are more likely to kind of sneak on and be embedded. So again, if you put it into a bag, then you can, when you call your primary care, present somewhere, you can have the actual tick, and then it's easier to identify that. The CDC has great references and resources around identifying ticks and what would be higher risk of transmitting anything. Again, if a tick has not been on for more than 24 hours, it's not engorged. If you have a tick that's just crawling on you, then you don't need to take any antibiotics. We do sometimes do prophylactic treatment if a tick has been on for more than 24 to 48 hours, is engorged, and we live in an endemic area for things like Lyme. Your primary care provider would be a great resource for that as well. But not everybody who had a tick needs to have antibiotics. The other thing is those much larger ticks, the American dog tick, are less likely to transmit certain things that cause problems in humans. So again, it's an important clarification when you do remove a tick. And again, also outside, right? We start to use our grills more as the weather warms up. We might actually do some, brush burning or have fire pits. And so just being mindful of making sure that those are far enough away from the home, and that the fire pits or any other sort of ground fires are completely put out and secured so that nobody accidentally walks through them. The grills, we generally say, need to be a minimum of 3 feet from a dwelling or other flammable things. And then fire pits, because it's much less secure than a grill, should be at least 10 feet away from the house or other things that can burn. I think the other thing is making sure that things don't get thrown into a fire pit that could explode. So things like aerosolized cans or other sometimes trash or garbage, or sometimes that cardboard that you're putting in can have things that are quite flammable on it, which is why we need to make sure that kids are further away from that fire in case something comes flying out. Again, we think about car seats. So car seats live in extreme environments. So if we think about the temperature swings, and that's why the plastics in those car seats have expiration dates. So it's important to double check those expiration dates and make sure that, especially if it's been used by more than one child, it might have expired. And what happens is that the plastic can become brittle and frail, and then the harness can pull through the shell of the car seat. So if it's expired, you absolutely don't want to use that car seat. And then there's also questions around, can I use a hand-me-down car seat? And the general recommendation is no, but if you can confirm essentially where that car seat has been used, and that it's not expired, hasn't been in a car accident. And there's great resources online around when does a car seat need to be replaced. So for example, if you are in a car accident, what are the reasons that a car seat would need to be replaced versus using it again? And then we also think about those the milestones. And again, we keep kids facing backwards for longer than used to be the prior recommendation. So some kids, up to over age 3 are still facing backwards, depending on what size they are. And then stage 2 is when they transition to forward facing. Stage 3 is more of that booster style forward facing. And then stage 4 is when they would convert to either a low back booster or just a seat belt. Be Seat Smart can offer recommendations of places to check the installation and the fit of a different car seat. Again, there's other resources online. Before newborn babies leave our nursery, then one of our car seat technicians does check that car seat and checks it in the car as well. So then we also think about helmets. So similar to car seats, if a helmet is in a bad crash, then that helmet needs to be replaced. They're not designed to be used again after they've already done their great job of protecting your child's head. Again, it's also important to double check kids grow quickly, right? And we've got great helmets now with lots of adjustability, but sometimes they do actually need a new size. There's lots of options for free or reduced helmets, either through your primary care provider or the local rec department. There's different resources online as well. So again, but making sure that that helmet actually fits correctly and that it's adjusted. A helmet that's hanging off the handlebars of the bike or the scooter is not very effective. So reminding kids where the helmet needs to actually be when they're on their wheeled devices. And then we also think about water safety. So as the ice starts to melt, again, we can be curious, right? So lots of those favorite winter hikes now might actually have running water. The safety around being out on the water or out on the lakes or ponds for ice fishing, that this is the time of year that ice is much thinner and it might even have a layer of snow on top, but the ice underneath is not as thick. Again, kids are really, really curious. So nobody should ever swim alone, and you should always identify an adult watcher anytime there is water around. Similar to as we start to do our spring cleaning, that sometimes we might have a bucket of cleaning solution or water, and that we need to make sure that a baby or a child is never within, sort of around that standing water. Infants and young children can drown in as little as 2 to 3 inches of water. So remembering that when filling bathtubs or doing other things around the home. Drowning prevention is really helpful with swimming lessons for both parents and toddlers. And I understand the St. Albans Rec Department does have swimming lessons. And then again, emptying those buckets, bathtubs, wading pools. It's also another great way of keeping down mosquitoes as we head into summer season. Again, latching the bathroom door or the toilets, and then all fences should, or excuse me, all pools should be surrounded by secure fencing. And again, we'd also just reminder around just making sure kids are up to date on their immunizations, that they've had their well visits. Your primary care provider is a great resource for, safety recommendations for that specific age child. Again, in this time of year, we sometimes also see a rise in asthma and allergy symptoms. So again, double checking with your primary care provider if it's a good time to restart any of those controller medications or those as needed medications. In general, the antihistamines, cold medicines, or other things are not recommended for children under the age of 2, and for kids ages 2 to 6. We usually recommend checking with your primary care provider for things like Zyrtec, Allegra, Benadryl, or the cetirizine, loratadine, any of those medicines that we might use on an as-needed basis. So there's lots of useful resources. Sometimes a great place to start is just by dialing 211. They can give you lots of different resources around childcare, housing, but they can also sometimes answer questions around where can I get my smoke detectors or, free or reduced car seats, helmets, those kinds of things. The American Academy of Pediatrics, the CDC, the Vermont Department of Health, Poison Control, safekids.org, and the Children's Safety Network are all great resources for specific questions or things. So again, this is a pretty brief overview, but hopefully got you thinking around, just like we start to clean out the closets or the gutters and those kinds of things this time of year, that checking the expiration dates on car seats and medications, making sure other things are secure, and that kids change and grow. So what was safe, last spring might not be safe this spring for that particular age child in your home. So a little bit of a whirlwind tour, but if there's any questions or things or comments, feedback.
If anyone has any questions, feel free to unmute your mic and ask, or you can pop it into the chat and we can answer it that way. So I have a question actually about ticks.
Yeah.
When you're removing them and you don't get the head, because sometimes that happens to me when I'm using tweezers and I'll pull it out, but the head inevitably doesn't come out. What do you recommend to do to get that out?
Yeah, so sometimes the safest thing is actually to just leave it in there and let the body will kind of push it out, similar to other foreign bodies. The tricky thing is when you start really mucking around in the skin, right? And you might actually cause more trauma. Sometimes if you just wait, and that the sort of irritation around that skin, once you let that calm down, even just waiting an hour or so, then you might be able to pull it out. If it's truly embedded and concerned around infection or ending up with, basically a foreign body, then you could go to your primary care provider, and sometimes they have different tools or using a magnifying glass, because essentially you don't want to cause too much localized trauma to that area. It's one of the other reasons why when you are pulling them out, trying to get as far down so that essentially the body doesn't detach from the head, which can be tricky, especially with a squirrely toddler that's running away from you while you're trying to get it out. So sometimes getting that first grab and being really careful with getting it as far down as you can, then you're more likely to get the head. Nobody's going to default you by, obviously we don't want to fill the urgent care and ER with tick removals, but if somebody's feeling really unsure about how to do it, we'd rather do it that way than end up with essentially a foreign body that somebody then tries to take out and causes some localized trauma that way.
Yep. Thank you.
Yeah. They're tricky.
Yeah.
But again, if you're checking on a regular basis, then hopefully they're not engorged or they haven't actually attached. So then it's less likely to be as tricky to get it out.
Yep.
Yeah.
Anyone else have any questions for Dr. Moran? All right. Well, hearing none, thank you, Dr. Moran, for your time.
Thank you.
We've got a few comments in the chat.
Those are always nice.
Yeah.
Yeah. But don't hesitate to reach out. Most of you know how to reach me, and we're all here to just try and enjoy the warmer weather when it does come, and keep everybody safe and healthy.
Yes. Thank you so much, Dr. Moran.
Have a good rest of your day.
Thank you. You too.